session. Welcome to you, sir.
Okay. The next is about the Uttaratantra, and where the first chapter is Adhyayy aoupadravika adhyayy vyakhyasyaamahe thovacha Bhagavan Dhanvantarihi. Now, about this chapter, the name of the chapter, nomenclature of the chapter is a bit confusing, in the sense the word aoupadravika will be referring to the upadravas, the complications, but the major content of this chapter is related to the anatomy of the eyeball. So, why and how of this is another of the issue. Of course, Dhallana has attempted to give some justification to this name, but I don't think that it's convincing. So, anyway, whatever it is, we will not bother much about that part. The Uttaratantra starts with the description of the need for that extra or appendicular component of the Samhita. And that adhyayanam shate vimshe yaduktam asakut maya vakshami bahuda samyag uttare arthani maniti idanim tat pravakshami tantram uttaram uttamam. Now the author says that the 120 chapters described earlier, they are almost complete, but any of those which are left over are described by in the next coming chapters. And again, there is a bit of controversy, like who is the author, whether it is the same author who has written the previous chapters, or is it a new author. These are the issues of controversy which I think we will not go into that part. Of course, apparently it looks like the author is different, the language style is different. So, whether it is Nagarjuna or somebody else, now that issue is discussed a lot earlier, so we will not go into that part. Now, Nikhilena Upanishyante yatra yogaha prasagvidaha शालाक्यतंत्र अभीताः विदेहाधिपकीर्तिताः ये च विस्तरतो दृष्टाः कुमाराबाधे हेतवः षट्सु कायचिकित्सासु ये चोक्ताः परमर्षिभिः उपसर्गादयो रोगा ये चाप्यागन्तवस्मृताः त्रिषष्ठिरससंसर्गाः सुसवृत्तं त्रैव च युक्तार्था युक्तयश्चिव दोषभेदास्तेव च यत्रोक्ता विविधा अर्थाः रोगसाधनहेतवः. The chapters, contents of the chapters are the Shalakya Tantra. Now, as far as the Shalakya Tantra is concerned, the Samhita very clearly mentions that the author of that Shalakya Tantra is Videhadipa. Videhadipa, a author who comes from the Videha Desha, who is supposed to be Nimi as such. Whereas with the others, there is no specific mention about the authorship. It's described as if the authorship is the same as the other part of the Samhita. The other chapters are mainly the Kumara Bhata, that's Kaumara Bhatya, and Kachikitsa chapters, and Upasarga Roga, that diseases, epidemic disorders, and Rasa Samsarga, the combinations of the Rasa. Swasthavritta also is mentioned in the Uttaratantra again. Swasthavritta also is mentioned in the Sutrasthana, so there is a bit of repetition, but the contents are slightly different. Then Tantra Yukti, these are the major contents of the chapter. Mahatattas तस्य तंत्रस्य दुर्गादस्य अम्बुधेरिव आदावेव उत्तमांगस्थान रोगान् अभिदधाम्यः संख्या लक्षणेश्चापि साध्या साध्य क्रमेण च. In the first part of the Uttara Tantra, it's about Uttamangastha, ears, eyes, nose and throat, the areas up something above the neck, the Urdhajatra Rogas, they are described and with the signs and so on. First of them would be the eyes. Vidyat Dvangula Balhapalyam Swangusthodara Samidam Dvangulam Sarvatasardham Vishagnayana Buddhudam Suvrittam Gostanakaram Sarabhuta Gunodbhavam Palam Bho Agnito Raktam Vatar Krishtam Sitam Jalata Akashad Ashwamargasya Jayante Neta Buddhe. Now, eyeball, the size of the eyeball, according to Sushruta, is 2 angula in width, and the whole diameter, this size of that is as big as that of the thumb of that person, and 2.5 angulas is the circumference. That's about the size of the eyeball. Now, whether this now there is a one notion, like in Sharira it said that the size of the eyeball doesn't grow from the childhood. Of course, it is not absolutely true. There will be a slight difference in the size, but the rate of growth of the eyeball is comparatively lesser, and the shape is it's a globular, and at the same time it's Gostanakara, elongated. Now globular component is the real eyeball, but along with the musculature it takes the shape of Gostanakara. So both these, so Suvrutta and Gostanakara, both are the true as such if you compare these two components as such. And it's having all the 5 Mahabhutas, and the Palam Bhuvaha, the fat contents are from the Bhumi and the muscles, and Agnitoraktam, from the Agni it's the blood which is flowing in. Vatat Krishnam, that iris, the black portion of the eyes is the Vata, and Sitam Jalat, that white portion, the sclera, is from the Up Mahabhuta. Akasha Rashmargasha, the tubes or channels which follow the or which secrete the tears and others, like the lacrimal glands and their apparatus, they are considered as due to the Akasha Mahabhuta. Now the other proportionate dimensions, Sushruta describes the anatomy of the eye in very detail, and the proportionate dimensions are mentioned as दृष्टिं चात्रतावक्षे यथा भूयाद् विशारदः नेत्रायामतिभागं तु कृष्णमण्डलम् उच्यते कृष्णात् सप्तमम् उच्यन्ते दृष्टिं दृष्टिविशारदाः. Now in the eyes, the visible portion of the eyeball, you have that sclera, that white portion, and then the cornea, that blackish colored portion, then the pupils, the internal opening. So you will have the 3 segments. Among them, Sushruta says, the netrayama tribhagam, 1/3 of the total diameter, the total diameter in the sense from the nasal end to the lateral end of the eyeball, if you measure, the 1/3 is about the cornea dimension, and the 1/7 is the size of the pupil. Now this ratio is mentioned by Sushruta, but practically what happens is the size of the pupil varies according to the intensity of the light, as well as whether the patient is looking at a far object or near object. In the dark, the diameter of the pupil will increase, and in the bright light, the diameter of the pupil will reduce. So naturally the ratio will alter, and even as per the accommodation, when you look at a distant object, the diameter of the pupil will increase, and when you look at a nearby object, the diameter of the pupil will reduce. So there is a reflex action of maintaining the size of the pupil to adjust the intensity of the light and to make the image focus on the retina properly. So ratio, as mentioned by Sushruta at this context, may not be very objectively described, but still the one of the important this parameter in the clinical assessment of the eyes would be there would be a assessment of the this routine ratio of eyeball and the say the pupils and the iris, and that ratio is considered to be around 0.62 to 0.69. In glaucoma it's increased, and this is about the eye pressure, okay, but the in the glaucoma also, there in the other conditions also, it will be varying to a certain extent. There is no such established ratio, and not much of a significance is given in the present ophthalmology for that. Instead, the issue is given about the pressure. Now when the eye pressure is increased, naturally the diameter of the pupils also would be vary, and it's which is given more importance than the diameter as such. Now there is a bit of confusion or the overlapping. In Sutrasthana, Sushruta gives the in the descriptions like the diameters. Dayana Tribhaga Parinaha Taraka Navamah Tarakamsho Drishtihi. Now in that chapter, Sushruta says Taraka is that black or the sclera, cornea, and the cornea is 1/3 of the eyeball. But in that context, Sushruta says 1/9 is the drishti. The pupils are considered to be 1/9 as such. So that's about the controversy. Now, which is true and why, and so we will not go into that part. The next part, anatomical aspect of the eyeball mentioned is mandala Sandhi and Patala are the three other important structural components. Mandalani cha Sandhi cha Patalani cha Lochane Yathakramam Janiyat Panchashatya Shadevacha. There are 5 mandalas, 6 Sandhis and 6 Patalas. Now these are Pakshma, Vartma, Shweta, Krishna Dristinam Mandalanintu Anupurvam Te Madhyaha Chatvaro Antyaha Yathottaram. Now, the mandalas are the circular structures which are present in a circular fashion, and they are the Pakshma mandala, the outermost mandala, Pakshma mandala, which is the hairs of the eyebrow, that outermost area, eyebrow as such, that's the Pakshma mandala. Vartma mandala are the real palpebrae, the eyebrow there, which tend to close and cover, which makes a circular structure. Then it comes the Shweta mandala, the sclera, and the Krishna mandala, the cornea, and then the Drishti mandala is the pupils. Now, the anatomy is quite detailed, but the only difference is how you approach it, how you analyze it. In the current anatomy, the way they approach is something different, where individual structures are named and they are not identified in the form of that circular structures, and their categorization is not done. Whereas Sushila has categorized them. So this is about what we see the visibly at a eye. When you look at the eye of another person, observe the eye of another person, the major visible portions are the eyelashes, the palpebrae of the eyebrows, and then the sclera, and then the cornea, and then the pupils, and these 5 parts are considered as a mandala, which have a circular appearance. Then Pakshma Vartmagata Sandhi Vartma Shuklagato Aparaha Shukla Krishna Gata Stvanyaha Krishna Drishtigato Aparaha Tata Kanina Kagataha Shastascha Apangaha Smritaha. Sandhi, the word Sandhi suggests the meaning of joint, but in this case, we will not consider this as a joint, rather an angle. Now, angles of the eyes, so some specific angular structures which are seen in the eyes, and that angular structures are the anatomically sensitive area, where either there could be a source of irritation, there could be formation of certain disease entities, and from the surgical point of view also many of these have a significance, and hence Sushruta names these as the Pakshma Vartmagataha Sandhi. The first of the Sandhi is in between the Pakshma and the Vartma, that the palpebral angle, where you have the eyelashes and the palpebral, the conjunctival surface. Now conjunctiva would have a surface which is adherent to the sclera, and then there is an angle formed, and then there will be a layer which is covering the palpebra also. The palpebral surface of the conjunctiva then merges with the epithelium, and at that point maybe it's a Pakshma Vartmagata Sandhi. Then Vartma Shuklagataha, where again the conjunctival membrane forms an angle with the sclera, that's the Pakshma Vartma Shuklagataha Sandhi. There will be Vartma, the palpebra, and the Shukla, that the sclera portion have that. Then Shukla Krishnagataha Sandhi, where an angular structure is seen in between that sclera and the cornea, which we now use the word limbus. Limbus, of course, as a conjunctival surface, intact conjunctival surface, there is no angle. But if you look at the structure, the most important, crucial part of the eye is that's the canal of Schlemm is presented at that part, and that's the area where you have that angle or Shukla Krishna Gata Sandhi. Then Krishna Drishtigataha Aparaha. Krishna Drishtigataha is the Sandhi which is formed at the cornea or the pupils, the ciliary muscles which form that circular structures, that radial and the circular ciliary muscles which regulate the opening and closure of the pupils. That's the Shukla Krishna Gata Sandhi. Then Krishna Drishtigataha Aparaha. Krishna Drishtigata, this is Krishna Drishtigata Sandhi. Tata Kanina Kagata Shastashapangaha. The other 2 angles are at the lateral angle and the medial angle. And the medial angle, you have the lacrimal duct gland and the lacrimal cyst as such. And there is a peripheral duct system towards the peripheral angle too. So these are the peripheral angles as such. So we can identify these structures mentioned by Sushruta with the current anatomy point of view. but the outlook is something different. The way you look at it is something different. The mode of detail which is given in the current anatomy and the mode of detail given in Sushruta is slightly different, but the structures are clearly identifiable. Then comes the patala. द्विवर्त्म पटले विद्यार्थ चत्वारि अन्यानि चाक्षिणी जायते तिमिरं तेषु व्याधि परमदारुणः तेजो जलाश्रितं भाष्यं तेषु अन्यत् पिशिलाश्रितं मेदः तृतीयं पटलम् आश्रितं तु अस्ति चापरं पंचमांशसमं दृष्टेः तेषां बाहुल्यम् इष्यते. Now, patala are again, when you take a cross section of the eyeball, as you see over here, the outermost portion is the bony, that what Sushruta says as the asti patala, the patala of the bones as such, and then comes the fat layer and the muscular layer, and that's Medus Tritiyam and Pishilashiram, Tevshanyat Pishilashiram, Tritiya patala and the Dvitiya patala, where you have the fat and the muscular tissues as such. Then comes the Tejo Jalashridam Bhaksham, where you will have the vitreous fluid. Vitreous again, it could be either the anterior chamber and the posterior chamber, that forms the other patala. So there, that anterior chamber and the posterior chamber, vitreous humor, which is the major fluid there. In between you have the drishti. Drishti is the lens as such. The lens is the one, and Sushruta says timira vyadhi, the cataract would be produced in that the lens as such. So that description of the anatomy is quite detailed. Again, the same mode of description is different. Then comes the siras. Siranam kandaranam cha medasak kalakasya cha gunah kala parashleshma bandhane akshnoh sirayutah. Siranusaribhik doshehi vigunehi urdhvamagadehi jayante netrabhageshu rogah paramdarunah. Now the siras, blood vessels, then kandara, the muscles of the and medas, of course the fat tissue over the area, they are the ones which hold the eye in a proper manner and control the functions of the eyes. The blood vessels of the eye are again, you have the central retinal artery which gives the blood supply to the retina, and then you have the posterior ciliary artery which gives structures to the eyeball, the walls of the eyeball. The posterior ciliary artery, either again you have the two branches, long and short branches like the ciliary artery branches, and then the short branches also gives the blood supply to the musculature, palpebrae. So these are the major vessels which are related to the eyeball, and correspondingly you also have the venous structures. Now Sushruta says the doshas, the vitiated components of the body, they reach to the eye through the eye, blood supply, and they produce the disease. Now as far as the transmission of the nutrients and transmission of the body contents into the eyeball, there is a very specific issue called as blood ocular barrier. From the pharmacology, current pharmacology point of view related to the eye, any molecular substance may not reach to the eyeball easily because there is a blood ocular barrier. As you have a blood brain barrier, there is a blood ocular barrier. Only a small molecular substances which are fat soluble, they can reach to the eyeball, and they can have the concentration in the different areas of the eyeball. The aqueous humor, which is a fluid component, is formed by filtration at the blood vessel area, capillary area, and hence the amount of the substance which can reach to that area would be much lesser, and there is a strong barrier there. And the substances which can reach to the other structures like the lens or in the anterior chamber also, there is a significant barrier, and hence when in the pharmacological practice, majority of the drugs are administered either topically over the surface directly so that it can be absorbed, or it could be into the intracameral, that's into the anterior chamber, or into the intramural, intravitreal, where it could be into the posterior chamber, and so on. So major method of pharmacokinetics in the current ophthalmologic practice is mainly in the form of a direct administration than really the systemic administration. And so is the case with the disease transmission also. Majority of the diseases like viral diseases or bacterial infective diseases, they do not reach to the eye easily. I don't say never. Doesn't reach to the eyes easily. So panophthalmitis, a pathology where the whole eyeball is infected, being produced due to a systemic distribution or systemic spread of the infection, is a less common entity. Rather, the infective pathologies like viral or the bacterial infections involving the eyes, they are mainly due to the direct contact. When either they come into contact with the conjunctival surface or there is a penetrating injury and hence the transmission has occurred. But eye is a better protected organ, and that blood ocular barrier is mainly from the point of view of protection of the eyes. Whereas Sushruta says like the diseases are transmitted through the bloodstream. Now, I don't consider this as an issue of controversy, but I think these facts have to be clearly understood as such. Then the tatra aviram sasamrambham ashtu kandupadehavat guru bhusha todara raga dehi justam cha avyakta lakshanehi sashulam vartmakosheshu shuka purnabhamev cha vihanyamanam rupe cha kriyasu akshi yatha pura drishtaya diman buddheta doshena adhishchitam tat. Now, the signs of the diseases of the eye can be made out by looking at the eyeball, where either there could be irritation, samrambha is irritation, or abilam, the whole color could be altered, there could be some thick discharges in the eyes, or there could be ashtu, there would be more tears formed, or there could be itching, or there could be some sticky substance over the eyeball, or there could be burning sensation, or there could be pain, or there could be reddish color, or many times avyakta lakshana, the signs may not be seen, and or there could be swelling and pain in the vatmakosha, that's in the palpebral area, or it may not be possible to see the objects clearly, vihanyamani rupe, the vision being affected. These are the important signs of a involvement of an eye, and then they will have to identify the disease. And tatra sambhavam asadya yatha dosham vishagditam vidadhyat netaja rogaha balavantastyuh anyatha. Of course, what I have told earlier is like conjunctival blepharitis, lacrimal gland infections are more common than the endophthalmitis. That systemic infection producing the eye disease are lesser, whereas the diseases which are produced through the direct transmission are more common. Now, depending upon their location of the diseases and their origin, the diseases are classified. Now, संक्षेप क्रिया योगो निदान परिवर्जनम वातादीनां प्रतिघात प्रोक्तो विस्तरत पुनः. The basic approach to the treatment of eye diseases is nidana parivarjana, and the other specific treatment is described when the specific disease is discussed. The common causes, common etiological factors which can produce the diseases of the eyes are ushnabhisaptasya jalapraveshat, durekshanat, swapna viparyayat, prasakta samrodhana, kopa, shoka, klesha, abhigatad, adhimaitanacha, shukta aranala, amla, kulatha, masha, nishevanat, vega vinigrahacha, svedad, atho, dhuma nishevanacha, छर्देह विगातात् वमनात् योगात् बाष्पग्रहात् सूक्ष्म निरीक्षणाच्च नेत्रे विकारान् जनयन्ति दोषाः. The common causes which can produce the diseases of the eyes are: if a person who is in an extremely hot environment gets into water immediately, that sudden changes in the thermal environment of the thermal conditions of the environment can be one of the factors which can produce the irritation to the eyes. It is absolutely true. Those who are mountaineering or so on, where there could be exposure to the extreme cold or extreme heat, they need to take precaution, otherwise that can be a cause for the irritation of the eyeball. The sclera tends to dry up and they will have the complications. We will discuss those issues later on when we go into the specific diseases. A persistent vision or a focused vision on a distant object or a very fine object also can induce the disease symptoms of the eyeball. Swapna viparyacha, that your sleep cycle being altered. See, normally you will sleep at night and during daytime you will awaken. If this cycle is altered, that can result in eye pathologies of the eyes. A persistent emotional disturbances like weeping or maybe anger or the sorrow being sorrow as such, or stress as such, or trauma or excess of sexual indulgence also can produce the impairment of vision. Nutritional factors, consumption of non-irritant or non-nutritious and irritant substances like shukta, aranala, kulatta, etc. also can produce the impairment of the vision, and diseases of the eyes can occur. Vega vinigrahacha, vega dharana also can be caused. Excess of sweating or exposure to the smoke or suppression of the vomiting or vamanati yoga, excess of the vamana, or exposure to the steam, bashmagrahata, sukshma nirishanacha. These are the common causes of the impairment of the vision or diseases of the eyes. Now, the whole classification of the eye diseases are considered as a Shat Saptatihi. 76 eye diseases are mentioned by Sushruta, and they are classified according to the dosha. Vata dasha, tasa pitta, kaphat chaiva trayodasha, rakta षोडश विज्ञेयः सर्वज पंचविंशतिः तथा बाह्यौ पुनर्द्वौ च रोगाः षट्सप्ततिः स्मृताः. Among the 76, 2 diseases are the external diseases. Then that's agantu, due to the trauma. Then vata dasha, from vata 10 diseases are 10 diseases are predominantly vata conditions, and 13 diseases are pittaja variety, 16 diseases are raktaja variety, 25 are the Chidosha variety. Then further classification would be again based upon the prognosis. Hatadhimanto nimisho drishti gambhirikataya yaccha vatahakam vartma nate siddhyanti vatajaha. Now we will be going into the description of each of these disease and maybe possible interpretation in the current situation in detail in the coming chapters. So at present we will limit only to the naming. Hatadhimanta, nimisha, this gambhirika drishti dosha, and vatahata varma. These are asadhya. याप्यो अथ तन्मयः काचः साध्याः स्युः स अन्यमारुताः शुष्काक्षिपाक अधिमन्तस्यन्दमारुतपर्ययाः. The yapya vyadhis are vataja kacha or any other vataja vyadhi, and akshipaka, that again shushka akshipaka, adhimanta, asyanda, and marta viparyaya. These are the conditions which are considered as asadhya. Now, asadhya hrustadhyadyo yo jalasravashcha paitikah parimlayi cha neelascha yapyak kacho athatanmayah abhishyando adhimanto amladhyuchitam shuktikachaya drishtihi pittavidagdha cha dhumadarshi cha siddhyati. Among the pittaja vyadhi, hrustadhyadya, paitika jalasrava, parimlayi, neela, and pittaja kacha, abhishyanda, adhimanta, amladhyuchita, shuktika, these are considered as asadhya. असाध्य कफजस्रावो याप्य काश्यश्च तन्मयः अभिष्यन्दो अधिमन्तश्च बलासघटितं चेत् दृष्टिः श्लेष्मविदग्धा च पूतक्ष्यो लगनश्च यः कृमिग्रन्थि परिक्लिन्नवर्त्म शुक्लार्मपिष्टकाः श्लेष्म उपनाहः साध्यास्तु कथितः श्लेष्मजेषु तु. Among the kaphaja vyadhi, the srava is yapya, and asadhya kaphaja the kaphaja srava is asadhya, whereas kaphaja kacha is yapya. The other ayapya conditions, abhishyanda, adhimanta, balasa gratita, shleshma vidagdha drishti, pothaki, lagana, krimigranthi, pariklina vartma, shuklarma pishtakaha, these are sadhyaha, they can be curable. Now, raktasravo ajaka jatam shonitarsho vrananitam shukram na sadhyam kachascha yapyaha tadvyaha prakirtiraha manthasyando klishtavartma harshotpato tadaivacha sirajata anjanakyacha sirajalam cha yat smritam पर्वण्यथा व्रणं शुक्रं शोणिता अर्म अर्जुनश्चैः एते साध्या विकारेषु रक्तजेषु भवन्ति. Among the रक्तज व्याधि रक्तस्राव अजकाजात शोणितार्ष and shonita shukra, these are asadhya. Then the shonita kacha also, raktaja kacha also is asadhya. Then mantha, chanda, krishtavartma, harshotpata, sirajata, anjana, sirajala, siraparva, and avrana shukra, shonitarma, arjuna, these are sadhya vikaras, curable. So that the treatment is mentioned. भूयास्रावो नाकुलान्ध्यम् अक्षिपाकात्ययो अलजि असाध्याः सर्वजाः. These are the asadhya vyadis of the Tridoshya variety. याभ्यः काचः कोपश्च पक्ष्मणः वर्त्म अवबन्धो यो व्याधिः शिरासु पिडकाचया प्रस्रारी अर्म अधिमांसार्म स्नायुर्म उत्सङ्गिनीचया पुयारसश्च अर्बुदं च श्यामकर्दमवर्त्मनि तथा अर्शो वर्त्म शुष्कर्षः शर्करा वर्त्म वै सशोफश्च अशोफश्च पाकः बहलवर्त्म च अक्लिनवर्त्म कुम्भिका बिसवर्त्म च सिद्ध्यति. The sadhya vyadis, their list are there. Of course, we will be discussing each of these diseases in detail. So at that time, we will discuss more about these as such and sadhya and asadhya issues also. Sanimitto animittascha dvav asadhyo cha bhashyo shat saptati vikaranam yeshat sangraha kirtita. The sanimitta and animitta drishti dosha are the asadhya. Now, the further classification is according to the location of these diseases, and that classification is nama sandhyashrayah tesham teshu vartmajastu ekavimshatihi शुक्लभागे दशैकश्च चत्वारः कृष्णभागजाः सर्वाश्रयाः सप्तदश दृष्टिजाः द्वादशैवतौ भाष्यजौ द्वौ समाख्यातौ रोगौ परमदारुणौ भूय एतान् प्रवक्ष्यामि संख्यारूपचिकित्सितैः. The Sandhi Ashraya, the diseases that are located in the Sandhi are 9 and in the Vartma are 21 and Shukla Bhaga in the sclera area 11, Krishna Bhaga in the cornea there are 4, Sarvashraya, the fan conditions throughout the eyeball are 17, Drishtya Dvadasha, which is related to the pupils and that the lens as such, they are 12. Then Bhashya, traumatic are 2. These are the classification further. Now all these classifications based upon the origin or location of the disease also is quite important. With this we will conclude this chapter. In the next chapter we will start with the individual diseases as such. Iti Sushruta Samhitayam Uttara Tantrantrakate Shalakyatantre aoupadraviko nama Prathamodhyayah. If there are any questions, we will try to answer and then wind up today. Right, there are no questions, so we will wind up. In the coming chapters, we will discuss each of these diseases somewhat in detail.